Hello, this is a video giving you brief information about vaping, where it started and where it stands now, and anything that might be helpful to you as you use our resources with your patients. This is the longest video out of this series. It'll take approximately 25 to 30 minutes to complete. So how did we get here? Vaping has been around since 2010, 2011, but it originated in Asia, China specifically, and moved to the United States eventually. The early vaping devices were large. They created great clouds, which was part of the attraction. They were an alternative to traditional cigarettes, which were viewed as uncool, maybe unsafe, unhealthy, something your parents did, etc. And there's an upswing in high school use till about 2015, and then it started going down because it wasn't new, it wasn't trendy anymore. The clouds were impossible not to see, so it wasn't a behavior that teens could do without adults knowing. However, in 2017, which is where you see on the yellow line in particular, which is high school students, and the blue line as well, middle school students, 2017 started a sharp increase. That point in time is when Juul entered the market. Juul's whole purpose was to have a new generation of tobacco users. Originally, they were a kind of startup company. They, of course, now have been bought 35% at least by Altria. So they're no longer quite that independent entrepreneurial spirit that they used to attract people. But what they did was they made a very small, very discreet product and then used social media to attract users, which means they use social media to attract teens. I'm going to briefly touch on COVID-19 and vaping. As anything that compromises the lungs, it makes COVID-19 more problematic. The symptoms will probably be more involved. If a teen or an adult, but anyone has been vaping or smoking, it impacts the immune system, it impacts lung health. Just by virtue of what a device is, your hands are up near your face. Teens share these devices between each other, which of course is also a big problem. And the more people cough and have wet coughs, the more they're spreading the virus. And those kind of things go hand in hand with vape use as well. So vaping does damage the lungs. It damages them in a very specific way. If you looked at lung tissue on a slide, you would see that there are particulate matter. So X-rays show ground glass opacities, very distinctive kind of injury that is different than smoking because particulate matter of vaping gets very deep in the lungs. Because of that, and because of the harm it does to the immune system, COVID exposure plus vaping probably means that the infection is going to be more severe and would certainly be a reason to discontinue use. Prior to the advent of COVID-19 in the United States, there was something called DVALI, an e-cigarette and vaping product associated lung injury that caused 68 deaths that we know about, and over 2,000, almost 3,000 cases. Now, these deaths included young people, although a lot of them were older, and there was a lot of ongoing physical damage caused by this lung injury, including in young people. So the symptoms, unfortunately, match all sorts of other things: cough, shortness of breath, chest pain, nausea, vomiting, diarrhea, vaping fatigue, abdominal pain, etc. What the CDC concluded was that the vast majority of these injuries were caused by vaping THC. So that's the psychoactive component in cannabis. Because THC is not legal in most states, sources providing THC vaping liquid were what we would call informal sources. So you have no idea where this was produced, who produced it. There is no quality control. You can't go back and do a batch sample to see if everything's okay with it. So it was unknown elements being inhaled, which were causing these injuries specifically. And what they identified was vitamin E acetate. Now, vitamin E acetate all on its own is maybe not as problematical, but when you put it with everything else that's in vape liquid and you heat it, it caused a lot of damage. One of the reasons that producers cut their cannabis liquid is because consumers have the mistaken idea that a more viscous fluid is going to be more potent. In reality, cutting it with a viscous material like this honeycut product you can see on the screen weakens the amount of THC, but causes its own set of problems past that. But then there was the pandemic and people stopped focusing on the valley. It does not mean that it disappeared. What we are wanting to look at today is how teens got hooked on vape devices after we had successfully encouraged over a generation of people that smoking was bad, that it caused cancer, that it stained your teeth and your clothes and your hair, and it wasn't the cool thing to do anymore. And now vaping is the cool thing. Part of it is advertising. They were really good at it. They took the playbook from Big Tobacco and applied it to a new device. They added attractive flavors, often in labeling that was nearly identical to other products on the market, like juice boxes and candy boxes. And they developed a different kind of nicotine. Nicotine salts are more easily absorbed into the body, and they pass into the brain really quickly. The other impact of nicotine salts is they make the throat hit from inhaling much less harsh than it would be with a traditional cigarette. So they made the behavior easy to do, and then they made the behavior easy to hide. What I have on the screen here is a typical desk. It doesn't actually look that different from how my desk usually looks, which is lots of stuff everywhere. But in this picture are a number of vape devices. If you want to take just a second to look at it and see if you can come up with them. Think you got them all? There were 6 devices. Products 1 and 4 are put out by Sworn. They look like highlight markers or Mia Drop, if you're familiar with those, flavoring for water. Not anything unusual to see, and they certainly don't look like a vape device. Product 2 is a pen, and those are more typically associated with vaping THC than they are with vaping nicotine. Product 3 is a Juul device. It looks like a slightly longer USB device, and the smaller component above it is the charging port that fits into a computer. 5, to me, looks like a highlight. I've used yellow versions of that for years, so I wouldn't think it was a vaping device by looking on it. And product 6, while it looks similar to number 3, the Juul device, product 6 is a puff bar, and they don't have that extra component where you can just change out cartridges. These are disposable, so use it, throw the whole thing away. So what should you know? Well, the first thing you should know is that only researchers call them e-cigarettes. No kid would ever do that. They also frequently don't think it's a tobacco product because it's not burning leaves, and they don't realize that it's a nicotine product. Almost all of the vape devices on the market contain some elements of nicotine. Most teens don't realize that. They think it's harmless water, or because this is in a different format than traditional cigarettes, the nicotine won't work the same way, or because a lot of devices now use synthetic nicotine and therefore it isn't derived from a tobacco plant directly. They don't think of it as tobacco. So if you ask them, do you use tobacco products? They're going to say no. They're also going to say no if you ask them if they use e-cigarettes, because they just don't think about it that way. So vape devices, you're vaping. Juuling used to be a word that was used a lot, but Juul's predominance in the market has gone down, so you might not hear it as frequently, but they took the noun Juul and turned it into a verb to describe their behavior. Dabbing is usually THC. You might hear vape juice, pods, vapes. A rip or a hit is your throat hit. And clouds are associated with larger tank model vaping devices that I don't see in the average teenager, but you might see in a young adult, maybe going to college at the moment. It's important to know when your young patient says something about it being just vapor, or there's nothing in there that's going to hurt me. For one thing, it isn't vapor, it's aerosol, and there is a difference, as you know. The aerosol contains droplets of what they are vaporizing, as it were. So some of those are really volatile compounds in addition to the nicotine. They include really fine particulate matter, which is what gets down into the very base of the lungs and causes so much damage. Heavy metals, nickel, tin, lead, cancer-causing chemicals such as formaldehyde, and flavorings that are safe to eat but not safe to breathe in, such as diacetyl, which causes something called popcorn lung. And also, these are still produced, mass produced, by informal sources, meaning it's not a regulated industry, and anybody with a garage can start putting liquid into pods and selling them online. There is nothing to stop them from doing that. The nicotine, as I said, in vape devices is different than the nicotine that someone would encounter smoking a traditional cigarette or cigar. Because they are nicotine salts and they're absorbed so easily, they get a much bigger hit of the nicotine. And in the United States, there aren't the caps on nicotine content in most other countries. So if you hear someone saying, well, there's an English study that said X, well, England caps the amount of nicotine that can be included in their vape juice, and it's much lower than the United States, which is pretty much true of all other countries. We are just letting the market bear what it'll bear as far as nicotine amounts, and it's a lot. So 1 Juul pod is the equivalent to 2 to 2.5 packs of cigarettes in terms of nicotine consumption. And most users, especially teen users, don't realize that. I want to draw special attention to this slide. The effect of nicotine, everyone's so sure they know what it is, but it is very different in an adolescent body than it is in an adult body. Adolescents, as you know, are still in the process of growing. Their brain is still in the process of being wired, and how nicotine interacts with that newly rewiring process is very different than how it would impact an adult. For one thing, smoking a cigarette doesn't make you chill. And a lot of teens are going to think that it lowers their stress and helps them deal with things better. It actually makes them more hyper. They are more susceptible to award. So reward, it makes them feel good. They get a really good hit, a little bit of a high off of the nicotine. Whereas adults, once they become addicted, it's not so much they keep smoking because it makes them feel good. They keep smoking because they don't want to feel bad. And feeling bad is what happens to an adult when they stop consuming nicotine. With teens, it's really not avoiding the bad, it's searching for the good, which is a very different kind of motivating behavior. Because they react to it differently, their withdrawal symptoms are not going to be anywhere near as severe seeming as an adult's. Not that they don't have withdrawal symptoms, they're just different. They tolerate these really high doses of nicotine once they get used to it, even though it might bother them in the beginning. And there have been study after study after study showing that early uptake of tobacco or nicotine behaviors increases the likelihood that a teen will go on to other addictive behaviors because the brain is wiring itself to this addictive rush. So all of those neurotransmitters still want to keep getting all of those lovely hits of dopamine that make them feel so good. And if nicotine stops giving them that, they look for other things that will give them the same kind of reward feeling. Just general health and safety risks. Obviously, there are surgical complications. When we first started talking to health professionals, 2017, 2018, we talked to a lot of anesthesia nurses who were really concerned that they had somebody, a young patient who might have compromised lungs and that they didn't know that. One, because they weren't asking the right questions. They didn't know the questions to ask. So the EMR might say, do you use tobacco products? And the teen's going to tell them no. Okay. A teen will probably tell them no, no matter what, if their parents with them. But if they ask questions again before the start of anesthesia and use the right language, meaning vaping, do you vape? They might get another answer, especially if they explain how important it is. Just like with traditional cigarette smoke, there are second and third hand consequences to vaping. The cotinine, which is part of the byproduct of the vape device, can be inhaled by anyone around them. And because it's an aerosol, so think this heavy liquid droplet suspended, covers every surface around them. So coffee table, desk, etc. If you have a young child in the house or pets, they can easily ingest some of this expelled aerosol. There are also poisoning and choking risks. They're very small devices that will easily fit into a child or a small animal's mouth. Nicotine is a pesticide. It's very toxic. So less than a teaspoon is enough to kill a toddler. And a lot of these vape systems come with like replacement juice, shall we say, that is pretty and brightly colored and very deadly, with not necessarily parental control or adult control openings. Some on the market do have the more adult-oriented push down and twist cap, but not all of them do, so they're very easy for a child to access. Also, we're talking about a device that superheats liquid. It gets hot inside. Also uses batteries that become unstable over time, and with extremes of temperatures. So if a teen is hiding these things in a car that gets super hot during the summer and very cold during the winter, we've had teens say that they hide them in heating grates at home. So once again, extreme temperatures, which makes the metal and plastic involved unstable and more likely to rupture, causing facial injuries. One question we always get from parents, and most of the time from teachers and school nurses, is how can I tell that the teen in front of me is vaping? They want easily identifiable steps that they can just tick off a checklist. And it doesn't work like that, because the vaping related signs and symptoms are so similar to a lot of other signs and symptoms of other disease processes. So They might have a different smell or scent around them, but it's pleasant. It doesn't smell like traditional cigarette smoke. It could be strawberries. It could be mint. It could be all sorts of things that are hard to say go directly with a vape device. And we're also used to teenagers using body sprays and lots of them that most adults don't pay any attention to the additional smell. Because this is technology, it is technology that delivers nicotine. There might be extra devices, extra charging ports, etc., on a laptop that they use. They're spending money. They're relatively cheap now. Puff bars, I think, cost under $3, which is cheaper than a pack of cigarettes. But it's still a large outgoing of money over time. So if they don't have money that you think they should have, or they're spending money because you know it's gone, but you don't know where it's gone, this might be one of the places they're spending money. It's a secretive behavior, so they're going to act that way. More time in the room, more time stepping outside, more time spent in the bathroom maybe than usual. And once again, because it doesn't smell like tobacco, if you walk in the bathroom after them, you're not going to think that, oh, my kid was in here vaping. Because of the high nicotine content, they might get a little neck sick, which includes a headache, might make them nauseous, dry mucous membranes. And because they're jittery and a little hyper, they maybe not consume caffeine that they were used to consuming. But all of this can be so many other things, which is why we have to learn to ask the good questions and not just base our diagnosis or our belief that somebody is using a nicotine product and is addicted to it on observation alone. So how do you do that? How do you start a conversation with teens? This is very different if you talk to a teen versus you talk to an adult and family, and it's really important that you delineate those two conversations. Using any of this is not good for us. It's not good for anyone, but you don't want an adult smoker who has switched from traditional cigarettes to vape devices to go back to traditional cigarettes. There's no solid evidence that moving to a vape device stops cigarette use. Quite frequently, what happens is that the person ends up being a poly user, so they're using both instead of a vape device being used as a means of stepping down like a nicotine patch would. That's not how they're designed. And as we know, it's not only replacement therapy, but behavioral management that goes into it. So they're not receiving any of that really from vaping. But we know what cigarette smoke does. We have decades and decades of research to show that, and we really don't want adults going back. What we want teens to do is either not start at all, preferable, or find a way to stop. But remember, nicotine is very addictive, and that's going to be hard. If an adult in the home is using a vape device, talk to them about safe storage, talk to them about not wanting their teen to start that behavior, and that sometimes, a lot of times, our teens copy adult behavior patterns. There are really good, as you know, FDA approved quit methods for adults, including nicotine replacement therapy. So we don't want to stigmatize adult behavior in the process of trying to talk to teens. So part of it is you need to talk early and often. One thing that came out of the pilot project we did with health providers was that talking about vape devices fit in pretty well with a HEADS assessment at 11 to 12 or a middle school vaccine visit. It's not too young to talk to an elementary school student who is transitioning to middle school and will see things in a middle school that they haven't ever seen on an elementary school playground or on a bus. You need to talk to them about this more than once. Once is going to be in one ear and out the other. So you talk often, right? Even at sick visits. If their lung health seems to be poor, talk to them about vaping to make sure they aren't doing that in addition. You can add the question. And once again, don't say, do you use tobacco? The question should be, do you vape? You can include that on intake charts, power chart, anything else, EMRs. Specify vaping exposure and use. So you can also say, do any of your friends do this? Because sometimes they'll admit to that friend who does a bad behavior, and we all know they really mean themselves. Provide resources. We're going to give you a lot of resources after this. That's part of the fun of finishing this longer section of the training, is that you get resources for yourself, for your teens, and for their parents or caregivers. Now, the gold standard is the 5 A's. Okay, so you're going to ask about vaping. You're going to advise them, both users and non-users, about the health impacts and dangers. If a teen is vaping, assess their readiness to quit. They might not be at the point where they're going to listen to you and immediately try to quit. So if you don't get a feeling that they are, make a note in your chart maybe to remember to ask them about quitting the next time you see them. If they seem like they want to, remember this is hard. It takes adults approximately 10 quit attempts before they're successful. And it's a very hard thing to do. It's a very addictive product. One of the most addictive products, nicotine. And then arrange a follow-up visit. Either you could call them, email them, text them, but make sure you touch base with them afterwards. But because you're busy, and I cannot bend time to give you more time sitting in there with your patient, we can do this in 3 steps rather than 5. You still need to ask. And ask in a way that is not judgmental, non-threatening, and phrase your questions so that they have to give you more than a yes or no answer. Advise users and non-users about the dangers inherent in the behavior and refer them for help. We have specific help for teens, including the information that's on the slide presently, but it will be included in all of the resource guides. Teens are much more comfortable vaping than they are calling and talking to someone on the phone, and there are text-based programs for teens that are evidence-based and that you can use to refer your patient. So as I said, how you phrase your questions is going to be really important to get at the answers that you want. So we've included some optimal wording on the left-hand side of this slide and some poor wording on the other. Once again, try really hard not to ask yes, no questions. You want them not to give you a monosyllabic answer. So what do you know about vaping? And this is your opportunity to correct any misinformation that the teen has. Do you know anyone who vapes? Once again, that's this mysterious friend who has the behavior. And have you ever tried vaping even just once? So you can talk about frequency, and there's a big difference between a kid who does it like every once in a while when they're out with their friends to teens who are doing this behavior multiple times a day. So you can take action. This is your advised part. If they're not using it all, it's not a lot, but you still need to talk to them. Preventative guidance. And we have flyers. We all know teens don't look at posters or flyers. We have posters you can put up in the waiting rooms, in the exam rooms, in the bathrooms, whichever you think a teen might be looking at. But that's probably not going to hook them in. We do have teen-based resources on the website that were designed in collaboration with teens, so they are more appropriate in their targeting and their wording. If they are the occasional, only when my friend has one and I see them on a weekend, once again, it's not an immediate intervention but you do need to talk to them about the addictive quality and whether they're ready to quit altogether. You can give them the information that they can use to text for help and a flyer if you think that's appropriate. If they're using frequently, you need to take immediate action. Remember, once again, still stay non-judgmental. An addiction is not ever gotten rid of because somebody disapproves of your actions. Behavioral health referral would be really good. It takes a behavioral health approach in addition to any other therapy you might want to give. We have our text-based lines that they can text. The American Academy of Pediatrics has also said you can use nicotine replacement for children. I realize that's off-label and you might not be comfortable doing that, but we do have a link at the end of this presentation where you can go to the AAP site to see what they say about it. So you're going to want to advise all teens, users and non-users, that nicotine is very addictive, that vaping liquid almost always contains nicotine and sometimes contains THC that they might not be aware of. It is in no way harmless water vapor. And vaping anything or being around people who vape can hurt your lungs, just like being around cigarette smoke can hurt your lungs. And when the reason anything is underlined on this slide is because really, if it's liquid, they're putting it into a pod, they're vaping essential oils, they're vaping vitamins, you name it. Someone has figured out a way to get them into a vape pod, and none of them are good for the teens. You are now going to have access to our Rethink Vape resources. We have parent handouts, we have teen handouts, which you can access in PowerChart with the keyword vaping. So you might have something, you can put it in a D-part summary for a teen and their family. These are available in both English and Spanish. We included pictures of devices for parents because a lot of times they don't even know what to look for. And we have honed these over the years and with physician feedback. In the last project, our health providers asked if they could have something small that they could keep in their pocket or hook on a lanyard that would give them just really basic information that they could share with a patient or the family. So we developed one at their request. We do have these available for download. If you need help getting it printed, you can contact me and I'll see if I can hook you up with it. The back of the card has QR codes that take people directly to the relevant part of our website so that they can look at things online rather than the paper that's never going to get looked at maybe, and just put in a folder when mom or dad get home. Some of our other resources are infographics, as I said, posters you can put up in and around your practice, as well as 4x9 display cards that fit into a Lucite display stand that you could put in the waiting room. Always refer. If someone is using, refer them. Even if they're not using regularly, they can go to Live Vape Free Virginia, which is a VDH program. Also accessible by Vape. They can go to the Quit Now, teensmokefree.gov to help with their withdrawal. It's people to help talk them through, but it's going to be text-based so they don't actually have to talk to an adult on the telephone. So here are the AAP resources I told you about. They include youth tobacco cessation, a whole section on considerations for clinicians, the 3-step model that I already covered. They have their own screening tools and resources and how to use pharmacological support such as nicotine replacement therapy. So if you go to aap.org/cessation, you can get to all of these things. Rethink Vape isn't about reinventing things. If there is something good and evidence-based out there, what we would prefer to do is act as a warehouse or a resource hub for a one-stop shop. So we've incorporated the AAP resources onto our website as well. Live Vape free resource includes online text-based programs, both for parents, guardians, or an adult, as well as for the teens. There is coach support available. It's free teen enrollment. And if a parent goes to the site, it's going to ask the parent who they are, kind of their age, to make sure it's a parent, not a teen. And then they'll branch out into the appropriate component. So if a teen can't think of a good reason to quit, you can talk to them about good reasons to quit, such as saving money. It adds up over time. Even if $3 for a puff bar doesn't sound like a lot, 2 or 3 puff bars a week, every week for a year is a lot of money. And you're going to be able to breathe better, do anything that they like for fun better without compromised lines. If they play in the band, if they're in chorus, if they're in drama, if they're an athlete. And don't assume that those groups are, because they have strong assets and strong community, that they aren't doing this behavior. We've found quite the opposite, that some of these groups do these behaviors as a group rather than acting as a protective influence. Regardless of what they think, nicotine is not going to help them focus better. Actually, it interrupts focus. And they're going to have less anxiety if they stop using nicotine products, which they all believe that the nicotine is helping them manage their anxiety. And it's doing quite the opposite. So resources, providers, the program overview that was in the first video you watched, a quick reference sheet, a health professional handout. You can go back and watch this training video more than once if you've missed something, if you have questions. There are teen and parent handouts in PowerChart. The keyword is vaping. And all you need to do, you don't need to remember any of the other websites we might talk about. If you go to rethinkvape.org, we have those resources available for you. So I did put some helpful links. You can click on any of these. But once again, all you need to do is go to the website, and all of these are under health provider resources. The key thing I want you to take away from this is, while there is a lot of available information, we are only ever a phone call or an email away. We'd be more than happy to help you and help you develop anything that you need. Thanks for listening.